Hello, hi, namaste. Welcome to MedicBird, second episode, Uncancering Cancer series with Dr. Nitin Singhal. Okay, why I am speaking this in this voice because this episode is about robotic surgery. Okay, that was too much drama. But the first question, because of this topic, first question which popped up in my mind that robotic surgery, is it really, a robot performing this surgery or just a surgeon, human surgeon is performing? And if robot is performing, then there is no need. Even I can consult people and get extra money. So what's the case? Please let me know.
So, thank you for asking this question. This is not actually a dumb question. In fact, this is the normal perception.
Yeah.
Most of the patients, when they come to me first, they have this perception that when we talk about robotic surgery, it is an advanced form of surgery because it will be performed by the robot. Little do they know that it is actually me performing this surgery, and time has still not come where a robot can take away my job. So my job is secured as of now. So, robot cannot do surgery on my behalf. Robot basically helps us in performing this surgery. And if you ask me when I talk about robotic surgery as a medical professional, when I say robotic surgery, it's basically robotic-assisted surgery. So robot actually helps me technically in performing these surgeries in a minimal invasive manner.
Okay.
When I say minimal invasive, again it means lesser cuts, smaller cuts, and so that the big incisions are not required that are used in the traditional surgery.
Okay. So you just told me that minimal invasive and smaller cuts. Okay. So I heard this is actually laparoscopic surgery. I'm sorry because this is like confusing me. How it is different from traditional laparoscopic surgery?
So again, a very good question, because laparoscopic surgery is something in which we do exactly the same. We take smaller cuts so that the healing time goes down. So robotic surgery, I would say, it's an advanced form of, I would say, laparoscopic surgery. We have several advantages over laparoscopic surgery because we have different instruments, the robotic instruments, which give us several advantages over the traditional laparoscopic surgery. Using robotic this instruments, I can do many more complex procedures which are difficult to perform or almost impossible to perform using laparoscopy, because the movements that we can do, they are restricted in laparoscopic surgery. In robotic surgery, we get a magnified view, almost 10 times magnified view. So what I'm seeing normally, 10 times magnified. So when I see 10 times magnified and with those long instruments and that precise cutting that I can do with robotic surgery, which is more precise than laparoscopic surgery, obviously the outcomes are much better. We get lesser blood loss, the incision size, they become even smaller, and obviously the pain quotient of the patient, that goes down significantly. So it all ultimately accumulates into a quicker recovery, because in today's fast life, nobody wants to waste their important and precious time in the hospital, and everybody wants to be up and moving as soon as possible, even if they are getting treated for I would say, a significant disease like cancer. So that is where robotic surgery scores over the laparoscopic surgery. And as a surgeon, the learning curve also is very high. Like when I say learning curve, it means my experience in terms of doing a surgery, specific surgeries, the number of procedures that I perform using laparoscopy vis-a-vis robotic, the learning curve would be much higher. I have been doing laparoscopic surgeries now for 10 to 12 years, and robotic surgery I have been doing now for, let's say, last 2 to 3 years. So acquiring the skills in the laparoscopy took me long time. Robotic, it was a quick transition, and I'm much more confident replicating the same surgeries and even giving better results to my patients using robotic. So I have been having this journey where I started as an open surgeon, started doing laparoscopic surgery for almost 10 years, and now last 2-3 years I'm doing robotic surgery. So I guess I'm in the best place to answer this. Yes, robotic surgery definitely gives me much bigger advantage in terms of giving better outcomes to my patients.
Okay, so according to you, because after listening to you, I would say this is the revolutionary invention in terms of cancer surgery. So, what specific type of cancer which are treated through robotic surgery?
So, again a very important question. Robotic surgery, or for that matter, any minimal invasive surgery, it is actually designed in a way that we can get into the cavities, deep cavities of the body. So where a normal human hand or normal human eye would have a difficulties in doing the surgeries. So in fact, some people come and nowadays ask me for robotic surgery, even for procedures like breast cancer or for that matter head neck cancer. So in head neck cancer, still we can do certain procedures robotically, but for breast cancers, robotic surgery is not an answer because it is a surface, I would say, surface part, and it can be very well managed by our normal traditional open surgery. So where does the robotic surgery plays a role? It plays a role in the abdomen. Abdomen, it's a big Pandora box. It's cavity. It has a lot of organs, and there are certain organs, let's say prostate, rectum, that is the distalmost part of the large intestine, colon, certain areas where our normal human hand and normal eye would find difficult to do the surgeries. If we try to take smaller incisions or even with bigger incisions, sometimes the tumors anatomy or the parameters are such that it becomes extremely difficult handling those sort of tumors. With robot, we get precisely into those areas. It has a big reach. I can go into all these deep areas and into very small areas where the distance, I would say, as less than 1 centimeter is there, and it is in the depth of, let's say, 10 to 15 centimeter, where my hand cannot reach, where their robotic arms can easily go there and can give me all that magnified view, where I would be hardly difficult to see anything. There I get such magnified view that I can do precise cutting. So that is where robotic surgery comes into play. So in short, if I have to answer, it is helpful for all types of major urological cancers, like say prostate cancer, where it is, I would say, revolutionized the treatment of prostate cancer, which was once considered as a very difficult surgery. Second, in continuation for the urological cancers, in kidney cancers, now is the era where we, as a cancer surgeons, don't want to always remove all the organs. We want to preserve the organs also. So kidney cancers, we try to save the kidney as far as possible in most of the cases. And kidney preserving surgeries, some complex locations where normal surgeries it would have been difficult. With robotic surgery, it becomes very easy for us to do this kidney preserving surgeries. Bladder tumors, where the entire bladder needs to be removed and need to form a new sort of a bladder, there robotic surgery can help. Then certain areas like retroperitoneum, it is the area where all the major vessels of the body, aorta and IVC, everybody has heard, it carries the major blood in the body from the heart to the various organs. So all those areas, it is difficult to assess. So in those areas, with robotic surgery, it becomes easy. Gynecological cancers, when you talk about uterus cancers, endometrial cancers, most of these patients are very fatty, elderly ladies, diabetic. So it becomes very difficult to treat these patients, and it is generally, they were considered very high risk for surgery, because if we would have done it with a traditional incision, the recovery time and the wound complication would have been a significant factor in determining the outcome. So all these areas, with the help of robotic surgery, my patients can get discharged in a very short span of time. When I'm talking about endometrial cancers, as less 48 to 72 hours, my patients get discharged. GI cancers, that is gastrointestinal cancers. So rectal cancer, that is the large intestine cancers, which is the distalmost part of the large intestine. Colon cancers, stomach cancers, and even now for complex cancers like gallbladder and even pancreas cancers, we have this technology of robotic surgery. And foot pipe cancer, that is esophagus cancer, we can use this. In addition, in the thoracic cavity, that is the cavity where we have the lung, the heart, there the tumors of the lung and the tumors of the thoracic cavity can be easily addressed. And in addition, in very small number of cases of head neck tumors, let's say some thyroid cases and some tumors of the oral cavities, which are posteriorly based, where a normal human hand cannot go, the TORS procedure, that can be addressed with the help of robot.
Oh my god, I was literally feeling that I just, someone threw me in the classroom of medical science. Okay, but that was a great answer, and I hope that everyone will know beautiful about things about.
There was no way I could have defined this in a much simpler way. I'm sorry if it sounded.
No, it is not. I am not that kind of guy, but I am just representing normal people.
So to make it easier for the audience, is basically all the tumors of the abdominal cavity and the lung cavity. These are the areas where you can seek robotic help. So in short.
Okay. So when actually it was invented, I'm very much curious about it, because traditionally, then of course, when it was not robotic surgery, people used to do laparoscopy, right? Then when actually it was invented and revolution came.
So, robotic surgery, you'll be surprised to know it all started almost 2 to 3 decades back in USA. And as you rightly said, laparoscopic surgery was in vogue. But if I tell you, if you compare that time, 2 to 3 decades back, 2 to 3 decades back, even laparoscopic surgery was not used to this extent. When I did my training at Tata Memorial Hospital, which is the alma mater of cancer treatment in India and across Asia, when I started my journey there, even then, that time, let's say 12, 13 years back, laparoscopic surgeries were done, but the amount was insignificant. Because the problem with laparoscopic surgery is it is technically very, very demanding on the surgeon. The learning curve for anybody to master those skills is very, very, I would say, steep, and it takes a lot of time. And laparoscopic surgeries, again, making anybody learn those skills, it takes a lot of time. And fourthly, still there are limitations because the laparoscopic traditional instruments that we have, they do not have that sort of maneuverability that they can go into those areas where the robotic instruments can go. And the magnifications, the video systems that we have in robotic, that is not there. And there are certain more advanced techniques which are coming in robotic, like some robotic staples and everything, which makes surgery joyful both to the patient as well as the surgeon treating those things, because you can do the surgery in a very, very precise and controlled manner.
Okay, so after knowing this, I am very sure that accuracy is very high.
Yes.
Because of this much, precision.
If you are telling about accuracy,
Yes.
I'll give you an example. Have you ever noticed this currency note, 100 rupees or 10 rupees or 20 rupees currency note?
Yeah, I've used it.
So if I
love a lot, but I don't know.
if you magnify it with a zoom glass,
Okay.
I'll show you certain areas which you would have never noticed. There's some embarking of RBI on that, some small threads,
Yes.
which is impossible to see by naked eye, and even with the magnified glass, it becomes sometimes very difficult. And when I see it on a robo, the same thing. When I was doing my robo training, I was this was part of my exercise for adjusting the camera. I saw that I could see that small embarking also in a beautiful magnified manner. So you can understand how magnified and optimized views we get in robotic system.
Then success rate would be like.
Success rate is it becomes, yes, obviously it depends on the surgeon also who's performing the surgery, but yes, it is a tool that actually helps the surgeon to perform the surgery in a much controlled environment.
Okay, but like, can you tell me the specific success rate that people can be?
So before I talk about that, it's just like everybody cannot be Sachin Tendulkar, even if you give the bat and ball. So it's basically you have to practice that and you have to enhance your skills. And it does has its learning curve. And for us, coming from both open laparoscopic surgery, it becomes easier. But that does not mean that anybody who embarks on the journey of robotic surgery can do the surgeries from next day. Yes, it does have its learning curve. But yes, obviously, robotic surgery enhances the journey of a surgeon as well as the treatment journey for a patient.
Okay.
Now, coming to the success rate, what you asked me. Now, when we talk about success rate in terms of cancer treatment, I would again emphasize this thing to people who are listening to this. When I treat cancer, it is not robotic, open, or laparoscopic. It's basically all three. I can give the same type of cancer results, because cancer treatment surgery, the results depend on how good I am clearing the tumor, how widely I am removing it, and how good I am doing the lymph node dissection. And for me personally, I can do all three, all the cases, whether open, laparoscopic, or robotic. It will be the same for whichever technique I use. So the success rate cannot be defined in terms of the cancer outcomes. The success is in terms of the patient recovery. Like typically by open surgery, if a patient starts drinking after major abdominal surgery, drinking or eating, it will take 3 to 4 days, 5 days, and patient would start walking by, let's say, 2 to 3 days. By laparoscopic surgery, the learning that would be reduced by, say, let's another 24 hours. With robotic surgery, it would be further reduced. And typically, my patients after robotic surgery, they're walking the next day, they're eating the next day, and the discharge time is much lesser, 3 to 4 days lesser than a conventional open surgery.
Okay. Okay. After hearing this much accuracy, I'm just getting one dialogue that cancer is like मेरा तो आतंक ही खत्म हो गया. But because of thanks to this much talented doctors, of course, it requires the practice. Before playing T20 format, it requires to gain skill in test format, just the way you said by giving example of cricket. So after hearing this much recovery time, smaller recovery time, I really want to know the Da Vinci robotic surgery. What is actually that? Because
Da Vinci is actually commercialized. Robotic surgery system has been commercialized by the name of Da Vinci because that was the first company which came out with the robotic system. Okay. So Da Vinci basically is a company which introduced the first robotic system in the world.
Nothing to do with
it's nothing to do with the robot per se. There are now many companies who have come up with. There's a Hugo and there are few more like SI and everything who have come up with the robotic system. But the Da Vinci system has several advantages over others. It was the first company, so obviously it got more time to innovate the system. There are several techniques which other systems don't provide as of now.
Okay, just my doubt got clear. Now, of course, this is the future of this robotic surgery. So, what are the common questions which patients ask while choosing this, while undergoing this robotic surgery?
So, the common concerns, like obviously, when somebody undergoes surgery, they are all anxious. And when I tell them that we are going to do the surgery with this thing, those who are not that well read about robo, sometimes they have their apprehensions also that robo will be doing the surgery. So if it goes out of control, then what will happen? Some virus comes into the robo. So now, as we discussed earlier, that robot is something, it's a tool and it is absolutely under my control. I am the master, I am controlling it. So robot cannot go crazy, it cannot do anything to you. Okay. That is one thing which people need to understand. Second concern most of the time is regarding the cost concerns which people have regarding robotic surgery. People feel, yes, obviously technology, every new technology will have its share of costs and it will be making the entire treatment slightly more costlier. But again, when I counsel my patients regarding the costs and the safety, so I always tell them this thing, see, it's a bargain, it's a trade-off. When you go for an open surgery, after surgery you're going to be in the hospital for a longer period of time, you'll be requiring more medications, so ultimately your bills are going to be higher that way. And when you're going to get discharged earlier, the hospital stay is going to be shorter, so some amount of the increased cost will be compensated by that thing. And the remaining cost, let's say after recovery you're taking 1 month to go to your job, okay. And after robotic surgery, if you're back to your job on 14th day or 12th day, so which is a better trade-off? So that way, if you see, I guess ultimately the price gets compensated off. Okay. And even the elderly patient, we talk about safety, elderly patient undergoing this surgery, when they're going to recover faster, obviously the chances of recovery are much better without much complications. So safety profile, as we discussed, it is controlled by me. The recovery is faster, so patient is going to recover fast. So it is a safe and in a way a more economical procedure than compared to the conventional treatment.
After hearing this much benefits and accuracy, I am literally sure that this surgery is my favorite. Of course, can you share some specific case that you just performed in robotic surgery and its complexity as well? So
we have done several cases. We do actually several cases every week robotically. So I would share 2 or 3 cases that we did in recent past. And one of them actually is very close to my heart because this patient traveled from overseas, traveled from Kenya. And he was an elderly gentleman, 65-68. And he had a tumor in the pancreas. Pancreas, as you know, is a complex organ and any surgery on pancreas is very difficult. This patient had previously history of coronary artery bypass grafting and diabetic, hypertensive, osteoarthritis, asthmatic. So he had a lot of many complications.
He was like near about to death only.
Not near to death. He had this tumor, but doing surgery the traditional way would have been very tricky on this. Exactly. Because the recovery time and everything could have taken a long toll on him. But then we, after reviewing his reports, we planned this minimal invasive robotic procedure for him on the pancreas. And I'm happy to tell you, he got discharged on day 5. He was up and about on day 1, as most of my patients, and he was out of hospital on day 5. And he traveled back to his country on 13th day. And now 1 month post surgery, he's doing absolutely okay. He's back to his work and he's actually telling me thanks for the same thing, that actually his cost of treatment got reduced. Because he would have gone by the conventional treatment, he would have to stay in India for a longer length of time, and that cost would have actually been much more than actually what he paid by giving that extra money to robotic surgery.
Okay. Actually, I've never thought like cancer would be this much easy. You actually made it easy. That's why this series has a name of Uncancering Cancer with Dr. Nitin Singhal. So this is it in robotic surgery. See you guys in the next episode with exciting topics.